In his address to the nation to extend the lockdown on Lagos, Ogun, and Abuja, the Federal Capital Territory, President Muhammadu Buhari appealed for a consolidation of efforts from all Nigerians towards a more effective implementation of the war against COVID-19. The president was in a generous mood, and that much was evident 24 hours later when plans for a comprehensive life insurance policy for those on the front lines were made public by the Presidential Task Force on COVID-19. But how adequate could all of this be in the face of such a problem with frightening dimensions? There are those, for instance, who believe that the numbers being fed Nigerians by the National Center for Disease Control and the Ministry of Health are artificial and hardly represent the true situation. They argue that not enough testing is being done, and for as long as that remains the case, they insist that Nigeria will always find it difficult to get a firm grip on the COVID-19 problem. Well, for greater insight into this matter, we are now being joined from Leeds, England, by Dr. Olorunda Rotimi, a Nigerian doctor who heads a regional laboratory that provides testing for the West and North Yorkshire region. He's a consultant histopathologist and clinical director of pathology at Leeds Teaching Hospital. Dr. Rotimi will be helping us look at what Nigeria actually needs in terms of testing, what type of testing, who should be tested, values of testing, where Nigeria is right now, and what the country should be doing in terms of the treatment and the management of patients. Welcome to the program, Dr. Olorunda Rotimi. Thank you for joining us.
Thank you for joining us, Doctor.
Thank you very much.
Yes, Dr. Rotimi, before we get into the professional and medical side of our conversation this morning, I'd like to take your reaction to the decision of the United States to suspend funding to the WHO. Do you think that this is the right step to take at this time? Or do you think that in some ways, some of these countries have now politicized the COVID-19 challenge that the entire world faces? What really will be the effect of the United States pulling back and suspending funding for the World Health Organization?
Thank you very much for that question. This is definitely not the right step to be taken at this time, because the whole world is dealing with a virus that is spreading around everywhere and at an alarming rate. And we all need to pull efforts together and not to divide ourselves. Humanity needs to come together now to see how we could curb this epidemic and pandemic as it is now. And United States decision or threat to stop funding to WHO is definitely not the right one. And this is not the time to play politics with an enemy that we can't see.
Certainly, Doctor, it is not the right time, and I think it came as a shock to many of us around the globe that such disunity would be in our faces at a time like this. Now, Doctor, I'd like to get your opinion on a recent statement that has come under criticism that was made by Melinda Gates, whereby she was speaking about the fact that Africa's numbers, in fact, I'm actually going to take her quote. She said, part of the reason that you are seeing that the case numbers still don't look very bad in Africa is because they do not have access to many tests. Look at what is happening in Ecuador, where you are seeing dead bodies out on the streets. And if we are not careful, this is going to be the case across Africa. What is your take on that statement that she made? And what do you think the reasons are for the low numbers of cases, that we are seeing across Africa, and also the low death rates?
Yeah, thank you. That statement by her is definitely correct, that unless we do enough testing, it is very difficult to know what is the prevalence of the disease in any society. And as the whole world have shown that the places will do a lot more tests, they discover more cases, and are more able to manage those that they need to manage. And it is certainly the case that in Africa, the testing rate has been very low for various reasons, and that may give a false impression of a low rate of the disease. But it may also reflect that there may not be that many diseases in sub-Saharan Africa because by the nature of the disease, if people that are infected and they have a severe form of it, they will show. You can't hide it. You can't hide the dry, persistent cough or a very high temperature. And I think part of the reason it may appear low in Africa for now is that if you follow the trend across the world, this disease seems to be one that travels. So the epicenters in the world are places where you have a lot of international travel. So New York, London, and Northern Italy, where people go on holiday. And even looking at Africa, South Africa is the highest country in Africa with the infection, and South Africa definitely has one of the highest international travels.
Well, Dr. Rotimi, as a Nigerian in diaspora, I'm sure that you will have been in touch with some of your colleagues in Nigeria, and you must also have been monitoring what is going on in Nigeria. So with the benefit of your position as an insider who is outside, who is looking inside, from what you have seen, what lessons do you think that Nigeria in particular still needs to learn? And what's your assessment of the approach that Nigeria has adopted so far, either with relation to testing or case management protocols?
Yes, thank you. From somebody following the news in Nigeria and seeing the trend, I need to first say that credit should be given to the Nigerian Center for Disease Control, NCDC. I think they are doing a very good job, and they have a very functional website with a lot of useful information. And also, I think Lagos State Health Ministry has also done very well in monitoring and following the cases that have come and in the way they're handling it. And however, there are a few more things that needs, excuse me, that needs doing, especially in the area of testing. Because if I should repeat the WHO mantra, test, test, and test. And the reason why we need to test, there are fourfold values to testing, is that first, by testing, you are able to track the disease. So as at last night, Nigeria said there are 373 cases in 19 states, including and Federal Capital Territory. So that is tracking. That's what the data for testing will give. And the other reason for testing is that it gives you opportunity to understand the epidemiology of the disease. And by that, you know the pattern of the disease, who gets the disease, who gets more severe disease. And also, testing allows you to improve on case management, to know who should you treat and where, and how do you prepare for that. And the fourth reason is that testing allows you to suppress transmission. So a case in point is the self-isolation center that have been opened up in Nigeria, in Lagos and Abuja, I believe. And that is part of the effort to suppress the transmission. And also the public campaign, and it was a good one on your television. We were listening to just before I came on now about publicity campaign of what people need to do, or social distancing, and how to improve personal hygiene. So those needs to be done. And but the other thing that Nigeria needs to prepare for, and if I should give any message, is to say prepare, prepare, and prepare. Of course, the stage of things in Nigeria and most of sub-Saharan Africa is in what the WHO classifies as the case as the scenario, transmission scenario type 3. So you have 4. So you have no cases at all as 1, and you have sporadic cases where you have 1 or 2 cases, and then you have cluster cases where you have more than 1 or 2, and it's getting difficult to trace them. And of course, the last stage is community transmission, which is happening in Europe and America, and definitely happening in Asia. And you can see the potential for all of the 4 stages in Nigeria. So, as I said, there are 17 states now that have not declared any disease, so they are in that stage 1. And there are states with 1 or 2 cases that are in the sporadic stage. And then you have the cluster cases like in Lagos and Abuja, and Lagos probably getting towards a community transmission stage. And what you do for each of those are different.
Certainly, Doctor, and I'm glad that you brought this up because I actually wanted to address and take in your analysis of the lockdown that has been put on Lagos and Ogun states, as well as the Federal Capital Territory and Abuja. Now, I'm saying this, Doctor, because recently the WHO Director General actually also came out to address the situation in developing countries, and he spoke on the fact that the deceleration rate of the virus is extremely slow, yet the acceleration rate of the virus is really quick. And what you find in developing countries is people live in clusters and therefore are more prone to catch and spread disease, community transmission-wise, and also they have less access to healthcare and resources. So maybe lockdowns may not be the most appropriate solutions to the problem. What is your take on the lockdown situation that we're currently facing in Lagos, Ogun, and the Federal Capital Territory? Do you think that we need to find a more Nigerian, unique solution to this problem, Doctor?
Certainly. And the lockdown has its own place and it has its own uses. But the first thing to say is that lockdown needs to be effective. And that we see in all around the world, and including where I live here in the UK. So if for lockdown to work, it needs to be effective and it needs some kind of degree of policing. And also, people's needs to be looked after. So their need to want to go out is minimized. But if their needs are not looked after, then the need to go out will be high. So the lockdown needs to be that. But the lockdown by itself will probably not achieve a lot. Lockdown needs to be done with other things, and testing is central to that. Because when you test and you know those who are infected and therefore are likely to spread the disease, you're able to isolate them, you're able to contact trace the people they've been in touch with. Because coronavirus, COVID-19, is a very highly contagious disease. One person can infect up to 5 people around them. And therefore, it is the social distancing, personal hygiene is very, very important. So lockdown by itself will probably not be very effective.
Well, Dr. Rotimi, you are a scientist, and this COVID-19 has caused not just panic, but also anxiety, and has disrupted the way we live our lives. And people are concerned about how soon a cure, a vaccine will be found for COVID-19. As somebody who is involved in all of that process, testing and the search for a solution, is there any hope in sight that this COVID-19 will go away very soon from the trend that you have observed?
Unfortunately, not. Because given the rate of infectivity that we've talked about, and also for a disease to be stable, you need to have a lot of herd immunity, and people who have been exposed to it and develop some immunity to it. And for COVID-19, the estimate is that you need to have up to like 80% of the population to be exposed to it to develop herd immunity. And we're very way far behind that at this present moment. And unfortunately, there is also no vaccine presently available, but there is a big race to develop a vaccine. And unlike what some political leaders are doing in trying to dissociate people, it is good to know that scientists are pulling together to work together to develop a vaccine. But vaccine development takes a long time, and it takes at least 12 months because you need to make sure that what you're developing will work, and therefore it needs to be well developed and it needs to be well tested to know that you're not even going to end up giving the disease to people, but you're going to give something to them that will help them to develop immunity against it. And we are way behind the vaccine at this time. And also, unfortunately, it's also that there is no cure for it at the moment. And there is really nothing also to take to prevent the disease. What we have available now is just treating the symptoms, but there are various trials to look at how to improve the treatment.
Thank you, Doctor. And I'm sure during the course of this conversation, we'll discuss a couple of those trials. I understand that there's some that are underway also for people with BCG vaccines. Doctor, now it's estimated that there are about 40,000 Nigerian doctors in the diaspora as a whole. Maybe you can help us to clarify that number. But through telemedicine and other means, how can Nigerian doctors in the diaspora right now contribute to the fight at home?
Yes, well, I do not have exact number of how many Nigerian doctors are in diaspora, but I know that going by even my own classmates group, there are a lot of us outside Nigeria, definitely. And as to how to have, well, there is an immediate impedance, which it doesn't mean we can't do anything because now that we all can travel anywhere, but even if I want to come to Nigeria now to have, there's a lockdown and on international travel. However, we can all have in directing things to people to what to do. So, for example, in my area of testing, one of the things I would say is the NCDC and the Ministry of Health should really be preparing how to ramp up the testing. And one way of doing that is to make sure that at least every state has one testing center. And just to underscore the value of testing, there are 11 testing centers in Nigeria at the moment, and 3 of them are in Lagos and 2 in Abuja, and then the remaining 6 are in 6 other states. And when you look at the effectivity rate that has been declared, or the positive cases in Nigeria, the top 6 numbers are in those states with the testing centers. And that gives an idea that, yes, testing is definitely, having access to testing is definitely an important thing in you to track the disease. And therefore, so the country should prepare to ramp up testing. And as I've said, make sure that each state has a testing center. Make use of available facilities, all the virology labs that are there in Nigeria. And this is the time to start training people. So the existing center that are testing now to train other people to share their protocol so that they are ready. And also, you need to start sourcing for reagents because this pandemic is affecting parts of the world where the reagents are produced, and they are looking after their own people. They are releasing to the country. And it is a time, following on from that report by the CBN governor, for Nigeria to look inwards, to empower the scientists in Nigeria so that they could come up to produce some of the reagents. The University Department of Chemistry can see how they could produce some of the reagents. And so that's one way that the country can get ready.
Well, Dr. Rotimi, why scientists are busy still looking for a vaccine? There are some persons in Nigeria, or indeed in Africa, who have said that perhaps the solution may lie outside the sphere of science. And in this regard, we have had persons, including traditional rulers, who have been recommending certain herbs that can be used. In fact, in one African country, it was recommended that people should take a lot of alcohol, because if the alcohol comes in contact with the virus in the throat, then of course there will be some chemical process that will neutralize the virus. Apart from the traditional solution, or what they call African solution to COVID-19, we have also had pastors saying that with holy water and get a potent solution to COVID-19. Is there a solution outside science? And do all these suggestions make sense? We'd like to hear from someone like you who is an expert in the field of science.
Well, going back to your last statement, as because I'm a scientist, I therefore really believe more in the science. Well, however, I'm also a Nigerian and African, and I know that there are traditional medicine in use. And one cannot totally discountenance some of those things because even the scientific treatment that we have come from traditional material, from herbs and leaves and all of that. But the challenge with the traditional treatment is about that how do you know the dosage? How do you know what people should take? How much of it should you take? And how do you know the side effects of it? Because a lot of chemicals in whatever name they are and drugs are toxins and they damage other parts of the body. So I have seen my primary area of specialism is in liver disease, and I have seen a lot of people taking traditional medicine and damaging their liver because they probably took too much or took the wrong thing. So that is the challenge with using traditional medicine. As to things like taking alcohol, yeah, well, maybe if you drink alcohol now, you drink it in enough concentration, it can suppress your virus for that moment, but it doesn't stop the virus dividing in the rest of your cell. And in the period that you are not drunk, you're still producing the virus and it's proliferating in your body. As to the spiritual side, did you mention about people talking about praying or yeah, well, that's a matter of faith, and what if people believe in that and it works for them, yes. But as a scientist, I believe that God also gave knowledge to produce the drug, as He gave us knowledge to produce food that we eat when we're hungry. So if you are unwell, it's probably better to take a properly produced and well-regulated therapy.
Thank you, Doctor, and I'm sure we'll come back to that as well. Now, with neglect comes regret, and that's something that we can see globally here, not just applicable to Nigeria, but other countries as well. The NHS is a victim of austerity. The USA has failed to provide affordable healthcare to its citizens forever. And really and truly in Nigeria right now, what we are spending on healthcare per citizen annually is 2,000 naira per citizen. So my question to you is, what advice do you have for the Nigerian government with regards to healthcare spending going forward? And what do you foresee if we continue to budget in single digits for healthcare in the country?
Yeah, to continue to budget in single digits is to continue to mortgage the lives of Nigerians, really. Because as the saying goes, health is wealth. And this virus that is really now showing to be a no respecter of anybody, including prime ministers and presidents and kings and princes, it's definitely showing people that you really need to invest in the healthcare facilities of your country. Following the news in Nigeria, I know that some high-profile personalities have been infected by this, but I'm sure they were not able to travel out because of the lockdown of places they will have gone to. And it would really have been nice for them to go to well-set-up healthcare facilities in Nigeria. So there is no doubt that the government definitely needs to invest more in the healthcare sector of the country, from primary healthcare to the tertiary healthcare in the country.
Well, Dr. Rotimi, before we wrap up quickly, you are based in the United Kingdom. What's the biggest challenge facing the United Kingdom with regard to COVID-19? Is it the economy, as the Office of Budget Responsibility pointed out? Is it the care homes, where we understand there are issues? Or is it with equipment, with testing facilities? And what lessons can Nigeria learn from the UK?
The biggest challenge is got a bit of all of what you said, because to many degrees they are all interrelated. But as somebody working in the system, what I see as the biggest challenge is, to some degree, the reliance of the United Kingdom on other countries in producing what we need for the testing, in fact, in respect to COVID-19 in particular. And if you follow the news here, it took a while for testing to take off properly, because we for many weeks, we were scrambling around looking for the reagents. For example, on one of the platforms that we use here in Leeds, the reagents are produced in 2 countries, where in the world, China and Italy. And these were countries that were really battling their own case. And to bring that to the Nigerian situation, therefore, is the 3 words I would say for Nigeria is prepare, prepare, and prepare.
Thank you very much, Dr. Rotimi. On that note, we'll have to wrap this up. And thank you very much for joining us.